So today we are going to be making a training video for nursing students relating to the primary and secondary survey, and we are going to be relating it to a patient situation with a pneumothorax.
So now we're going to talk about the definition of a pneumothorax and the types. So a pneumothorax is the presence of air in the pleural space. There is a resultant complete or partial collapse of a lung caused by the accumulation of air in the pleural space. This condition should be suspected after any blood trauma to the chest wall. Pneumothorax may be closed or open. It's associated with trauma, may be accompanied by hemothorax, a condition called hemopneumothorax. And there are several types. There's closed, which is no associated external wound. Open, when air enters the pleural space through an opening in the chest wall. Tension pneumothorax, which is pneumothorax with rapid accumulation of air in the pleural space, causing severely high intrapleural pressures with resultant tension on the heart and great vessels. Hemothorax, which is an accumulation of blood in the intrapleural space, and chylothorax, which is the presence of lymphatic. And in this situation, our patient has an open pneumothorax.
Okay, so now we're going to talk about primary and secondary surveys. So basically, they're a very quick assessment that's used in emergency situations, either in the emergency department or in the community. And basically, it helps the nurse or any healthcare provider determine what the primary focus is for the patient. So in the primary survey, we have airway, breathing, circulation, disability, and environment. And this one is performed really quickly. And then in the secondary survey, there's full set of vital signs, include the family, there's give comfort measures, head to toe, and history, including pain assessment like PQRSTU, and inspection of posterior surfaces for other injuries. So now I'm going to talk about airway. Of course, this is all in order of priority. So starting with airway, we want to assess for patency. The quickest way to assess this is to basically speak to the patient. If the patient is able to respond in full sentences, then you can assume that the airway is not obstructed. Otherwise, you want to assess for foreign bodies, respiratory distress, things that could indicate that the airway is obstructed. In the specific situation with our 42-year-old man in the motor vehicle collision, he has visible respiratory distress. However, the airway appears to be open and patent. So all you want to do is to maintain the airway with cervical alignment. Since the patient suffered trauma and the spine hasn't been confirmed intact yet, you want to use a backboard and a nut collar to maintain spine alignment. Next on the list is breathing. So what you want to assess is you look for paradoxical chest movement, accessory muscle use. You want to auscultate the lungs, so you want to bilaterally assess air entry. You want to assess for adventitious sounds and all these things. Also inspect for tracheal position. If there's a shift in the trachea, that could indicate tension pneumothorax. You also want to inspect the chest for trauma or the neck also. So interventions that we would implement for our gentleman with the open pneumothorax. Since he presents with asymmetrical chest movement, edema on the chest wall, and has a visible open wound on his chest, you want to provide ventilation with high flow oxygen and a non-rebreather mask. You want to have suction available at the bedside in case secretions build up and he needs suctioning. And if you don't have any chest sounds on one lung or both sides, you want to prepare for chest tube insertion. Now for circulation, you want to check for radial, carotid, femoral, and pedal pulses. You want to assess skin temperature and color, cap refill, jugular vein distension, If you suspect hypovolemia, you would look for cool skin and tachycardia until hypovolemia is ruled out. Same thing for spinal shock. That would present with bradycardia, hypotension. And in his case, our gentleman's case, you want to apply pressure to the wound if it is bleeding to prevent excessive blood loss. So further interventions for this gentleman would be, again, assess his extremities for other lacerations that could have been from the glass flying out the window or things like that. You want to inspect the dressing on the open pneumothorax. Make sure that the paramedics put a 3-sided dressing, which allows air to escape this pleural space but prevents air from re-entering the pleural space. You want to assess circulation, sensation, and movement in his extremities, skin color, cap refill, and pulse quality.
So to continue with our primary survey, we have disability, which relates to the neurological system. So we would need to assess the level of consciousness, and we can use the Glasgow Coma Scale, the PERLA assessment, an assessment of the gag reflex, doll's eyes, along with many other assessment tools that are used to determine if there is brain damage. So in specific to our situation with our 46-year-old gentleman with a pneumothorax, we would want to establish cardiac and oximetry monitoring, possibly prep for the OR or ICU transfer, as well as maybe a chest tube insertion. We would also want to assess the Glasgow Coma Scale, as well as the level of consciousness and PERLA. So for our last component of the primary survey, we have the environment/exposure, which basically means to fully expose the body to assess for further damage or unidentified trauma. But we also have to always maintain patient dignity and patient warmth, especially in situations in the community. So now that concludes the primary survey. On to the secondary survey. The first part of the secondary survey is a full set of vitals, as well as including the family. So we would want to do a full set of vitals, including blood pressure in both arms, possibly laying and sitting. We would also want to do heart rate, so assess for rate, rhythm, and strength of the pulse, breathing, rate, rhythm, and depth of breathing, temperature, either PO or tympanic, and also O2 sats. And we can use, if limbs, fingers, or toes are not available, we can use things like earlobes. And then 5 interventions that are common in an emergency situation or in an emergency department include the insertion of a Foley catheter, the insertion of an NG tube, ECG monitoring, arterial blood gases monitoring, as well as O2 saturation monitoring.
So to finish off the secondary survey, we have G, H, and I. G is for giving comfort measures, so pain medications, reassurance, warm blankets, repositioning the patient. H is history, so the acronym we use is SAMPLE. So symptoms, allergies, medication, past medical history, last meal, events leading or environment related to injury. We also do a detailed head-to-toe assessment along with a pain assessment like PQRSTU. And the last component is inspection. So we ensure to inspect posterior surfaces of the client. When doing so, we make sure to maintain neck alignment, so possibly having to use the log roll. And that's the end of the secondary survey.
I will now be explaining the emergency interventions before HS tube insertion. So the first one is we always have to ensure a patent airway. We have to administer high flow oxygen with a non-rebreather mask, establish IV access with 2 large bore catheters, as well as begin fluid resuscitation as appropriate related to the patient's specific situation.
We also want to remove clothing to access injury. Cover sucking chest wound with non-porous dressing taped on 3 sides, which prevents air to enter chest wall by allowing air to escape the pleural space. We assess for other significant injuries and treat appropriately. And we ensure to place the patient in semi-Fowler's position or position patient on the injured side if breathing is easier. After cervical spine has been ruled out, this facilitates non-affected lung expansion.
Okay, so I hope this helped you guys better understand primary and secondary surveys, specifically to a situation like a pneumothorax. And if you need any more information, let's say for chest tube insertion and how to manage a patient with a chest tube on a medical unit, you can refer to the medical surgical textbook, which we will reference at the end of this video.